EBOO stands for Extracorporeal Blood Ozonation and Oxygenation. Extracorporeal means outside of the body, blood, obviously, and then ozone and oxygenation. So we're taking the blood out of the body, adding ozone, adding oxygen, and then putting it back in.
It's our strongest treatment that we offer at this clinic, but our patients oftentimes tolerate it better than other treatments because we're actually detoxifying the bloodstream during the treatment.
In your cells, you have these little kind of like organs, but they're called organelles, which are the organs of the cell. One of those is the mitochondria. So the mitochondria, colloquial, has been called the powerhouse of the cell. Basically, that is where the energy, all your cellular energy is made.
If our mitochondria aren't functioning well, we aren't getting proper energy, we don't feel well, and we can have chronic pain.
EBOO therapy, one of the things that it does is helps support the mitochondria of the cells.
It's working through ozone, oxygen, UV light, and full spectrum light. Through that stimulation, our mitochondria can heal and function at an ideal level.
We're really looking for what is the root cause of the illness. A lot of patients that come in say that they have been seen by multiple doctors, multiple specialists. Either everything looks normal and they can't find a diagnosis, or they have found the diagnosis but they still feel like there's something further upstream. Like, why is this happening to me? What is the true cause of these symptoms or these conditions? And treating it there, because if you can treat really high upstream, a lot of the problems that are further downstream actually just resolve just by treating that origin.
So because it's treating in such a broad spectrum way, that's why we see so many conditions have benefit with EBOO therapy. It's actually more about treating the person than necessarily treating a disease state. Of course, many diseases get benefit, but we look at this as a whole body treatment.
Conditions that we see most commonly would be Lyme and then the tick co-infection. So your Babesia, Bartonella, Anaplasmosis, autoimmune conditions, which we're seeing a ton of those now, and that's such a wide umbrella. COVID has been a big one now, more popular, more recent. So COVID, but also long COVID, and then vaccine injury.
I mean, EBOO therapy is synergistic with many treatments. So many patients are already on either supplements or medications or doing other therapies, and our team can help determine what role the EBOO therapy can play. It doesn't have to be a single treatment that someone does. It can be part of an overall healing plan, but it works in very complementary ways. There's very few medications that interact with EBOO therapy. We actually have patients who do just this as a treatment and get amazing responses, but many of our patients are using it in conjunction with other treatments, and when you're using with other treatments that work really well, oftentimes you don't need as many EBOO treatments to get to your treatment goals.
Since coming to the AIM clinic, I've done a bunch of different treatments, and most recently have been doing EBOO, which for me and my schedule and whatnot is the treatment that I would say lasts the longest and is the most effective for me. Everything else is amazing, but with my work schedule, it's been harder to get in here a couple of times a week, and EBOO keeps me afloat for about a month. The biggest things I've noticed is increased energy. And when I say that, it's not for a couple of days after the therapy. When I say it's lasted a month, I truly mean that, where my energy levels are a lot higher. Twitching, neurological symptoms, I don't have any issues with those during that time frame for a month or so, even longer. But I really feel the impact for about a month, 2 months, which is amazing. And one of the biggest things I noticed too is sleep. Like, I really, really struggle to sleep. And after I do this, I'm gonna go home 7:30 after I eat dinner, hit the couch and drool basically the whole night while I'm sleeping. So really, really has helped with neurological symptoms, energy, and just overall toxic load is definitely decreased big time.
The order of operations for the EBOO therapy: number one, I'm going to put an IV in both arms. The blood is going to be removed out of one arm. First, it's going to go through the hemolumin UV full spectrum blood irradiation device. Then it's going to loop around. It goes through the tubing. We add a little bit of IV fluids with some heparin, which is a blood thinner that helps to prevent any type of blood clotting from occurring while the blood is outside of the body. It runs through a pump, which runs the system, and then it goes into the filter. So in the filter, the blood is ozonated and oxygenated. Basically, it's actually a reversed dialysis filter. So the blood runs around the filter. We put ozone and oxygen into the middle, and it's a slow, continuous infusion of ozone and oxygen into that blood. So as with some of the other treatments that you're getting big boluses of ozone at one time, you're getting a slow, steady kind of trickle of ozone, which allows us to give more overall, but the patient has a better response to it. So from there, it goes through one last little trap just to prevent any type of clots if there were from forming, and then the blood goes back into the body and an IV in the opposite arm.
EBOO therapy has a very low side effect profile. Most patients feel better immediately from treatment. Occasionally some have some fatigue after treatment, but this usually resolves within a few days.
Since I've been here, I've done hundreds of treatments. I've never had anybody have a negative response to it. As far as side effects go, it really varies from person to person. Some people feel immediately better. Even during the treatment, they feel better. Good portion will feel a little bit run down, a little bit tired for a day or two, and then they start to notice the real benefits in that first week or so. But as far as the safety goes, there's things that we'll do. We'll do some basic blood work. We'll take a patient history to make sure there's no contraindications. We really wouldn't do it in a pregnant person, but to be perfectly honest, that's more about medical liability than anything. You are getting a small dose, a very small dose of blood thinner. So if anybody had a clotting disorder, that would be something that we would probably not do. But basically speaking, it really is. It's very safe. I haven't seen any type of negative outcomes with it. If you're positive for the G6PD genetic marker, that would be one potential contraindication, just because you're prone to blood lysing if you are exposed to high oxidative stress. But that's really the only major contraindication, and even that, there are things that we can do to make it safe even for that person. One of the questions that people ask a lot is, why do I want to go for the EBOO treatment, especially because it is a higher price point than some of the other ozone type treatments. What I will say is, when you look at the subjective results that people report, you can do one EBOO treatment. 1 to 3 is usually a pretty safe range, but they will talk about one EBOO treatment even being equivalent to multiple, if not tens, of some of the other ozone treatments. So yes, the bulk price for an EBOO treatment is higher, but when you look at it over the course of multiple other ozone treatments, you can spend less doing just the EBOO treatments than doing multiple of the other ones when it all adds up. You have patients that do travel from all over, from Canada, from all over, at the very least, New England. So for that person that can't make an hour-long drive back and forth, or multiple hours once a week, to be able to come in and do an EBOO once a month or even every few weeks is much more manageable, and they're getting the longer-term benefit from it.
The first step in terms of becoming a patient for EBOO therapy is to have a visit with one of our providers. At that visit, we do a comprehensive health history, look at labs, and discuss treatment goals. From there, we decide what kind of dosage and frequency would be best with EBOO therapy, and usually we can get patients going very quickly with EBOO therapy and start the healing process, and they start to feel better even from their first treatment.